Good morning. My name is Kanaparthi Bhuvana Dedeepya, studying second year medicine September batch. What is your name and your date of birth? Okay. Today I am going to examine sensory testing and reflexes. Is it okay for you? Wash or sanitize your hands. When testing sensation, use a symmetric pattern on both sides of the body. Comparison helps us to better identify where sensory losses occur. By identifying the distribution of sensory abnormalities and the kinds of sensations affected, you can interfere the location of causative lesions. Warn the patient, then use the sharp end of a cotton swab. Stay sharp. A previously unused safety pin or some other suitable tool. Ask the patient to close his eyes, then starting with the arms test scattered areas in a symmetric pattern on both sides of the body, occasionally substituting the blade end for comparison between sharp and dull. Discard the broken swab after using it. Going to touch you with this cotton wisp. Whenever you feel it, you say okay. Close your eyes. Next, access vibratory sensation using lightly vibrating low-pitched turning fork. Have the patient close his eyes. Tap the turning fork on the heel of your hand and place it against the soft distal tissue of the finger and a large toe. Ask the patient to tell you what he feels. Ask the patient to tell you when the sensation stops. What do you feel? The same thing. Okay, tell me when it stops. Then move the turning fork closer to the trunk to see if it is prescribed even in a normal patient. To test position, sense, hold the sides of the patient's big toe with your thumb and index finger. Avoid touching the other toes. Ask the patient to close his eyes and identify the direction of motion. Repeat several times on each side in an irregular sequence. Then cut here with the big toe on the other foot up. The upper extremities begins with the finger on each of the patient's hand and moving more appropriately to the metacarpophalangeal joint and beyond it. Stereognosis, the ability to identify an object by feeling it. Ask the patient to close his eyes, then place a familiar object in the palm and ask the patient to identify it. Repeat the procedure on the other hand using a different sized object. To test graphis tissue or number identification, ask the patient to close his eyes and use a blunt object to draw a large number on the palm. Using two ends of an opened paper clip or the ends of two pins, repeatedly touch the patient's finger pad with the 2 points at the same time and with 1 point occasionally. Be careful not to cause pain. Ask the patient to identify if he is being touched with 1 or 2 points. Then reduce the distance between the points so that you can determine the minimum distance at which the patient can identify 2 points on the finger pad. The distance should be less than 5 millimeters. To test point localization, ask the patient to keep the eyes closed. Then touch a point on the patient's skin. Ask him to open his eyes and point to place the touched. Alright, close your eyes. Here comes the first one. This test is especially helpful for locating sensory loss on the trunk and legs to test double extension. Use your fingertips to provide stimulus in either one area of the patient's body or in two areas simultaneously. Deep tendon reflexes. By testing the biceps, reflex the patient's arm must be relaxed partially. flexed at the elbow and positioned with the palm down. Depress the biceps tendon with your thumb or index finger. Strike your thumb or finger briskly with the reflex hammer. You should feel the biceps muscle contact and see flexion of the forearm. To access the biceps, flex the patient's arm at the elbow with the palm towards the body and pull the arm slightly across the chest. Strike the biceps tendon above the elbow. Watch for contraction of the biceps muscle and extension at the elbow to elect the supinator or brachioradialis. Reflex the patient's forearm should rest on the abdomen or lap with the forearm partially pronated. When patient is ready, strike the radius 1 to 2 inches above the wrist. Observe for flexion and supination of the forearm. To test the knee reflex, locate the patellar tendon with the patient's knee flexed briskly. Tap the tendon just below the patella. Test the ankle reflex if the patient is sitting. Dorsiflex the foot at the ankle. Ask the patient to relax. The patient is lying down, flex one leg at both hip and knee, rotated externally so that the lower leg rests across the opposite shin. Then dorsiflex the foot at the ankle and strike the Achilles tendon. Repeat this test on the opposite side. Support the knee in a slightly flexed position with your other hand. Dorsiflex and plantar flex the foot a few minutes and then sharply dorsiflex the foot and maintain it in a dorsiflexion look and feel for sustained rhythmic oscillation between dorsiflexion and plantar flexion. To test for plantar response, use an object such as the wooden end of an applicator stick or the handle of your reflex hammer to stoke the lateral aspect of the sole of the foot from the heel to the ball, curving medially across the ball. Warn the patient that the stimulus may feel uncomfortable. With the patient lying down, place your hands behind the patient's head and flex the neck towards until the chin touches the chest. Flex at the hip and knee and then straighten the knee. This action normally produces discomfort behind the knee during extension but should not cause pain. Pain and resistance to knee extension is a positive clinic sign for low back pain with no pain. The physical examination on sensory testing and reflexes is completed. Thank you very much for watching.